Hi. Today we're going to be talking about heart healthy diets.
I'm Melissa.
I'm Hannah.
I'm Emma.
I'm Lauren.
I'm Taylor.
Okay, so as you heard, we're going to be talking about heart healthy diets and ways to improve your heart health because we know you guys work in very stressful jobs and that can be very detrimental to your heart health. So I hope you're ready to learn about heart healthy diets. Hope you guys all pick A. And a real quick question are just because we want to test your knowledge about how much you know about diets and how much you know about what your heart really does for you. So what is a DASH diet? Why is sodium cholesterol bad for you? What is the recommended daily intake of sodium? What food groups predominantly feature in Mediterranean diet? And which is a heart healthy diet?
So first we're going to talk about heart conditions and disease. A primary factor in that is hypertension or your blood pressure. And blood pressure is the force that your heart pumps against the walls of your blood vessels. A rise in this force is known as hypertension or high blood pressure. And this can be caused by multiple factors. It could be diet, genetics, your body mass index. Um, but we're mainly going to focus on the things that you eat. And things that affect blood pressure would be your salt intake or how much cholesterol or saturated fats you're eating. Um, and hypertension causes heart disease by reducing the amount of blood and oxygen reaching your heart. So it's very important to focus on your diet to make sure that you are lowering your blood pressure and reducing your risk of heart disease.
Okay, as Lauren did say, one of the big factors of hypertension is high cholesterol. And this is when your blood has too much fatty substance. And it's going to be caused by a fatty diet, being overweight, and not exercising enough. So, how this happens is that when you have too much fatty foods and that cholesterol builds up in your veins, it's harder for the blood to go through and it will cause that hypertension. So it does increase your risk of heart disease and poor health. And it can, like I said, can be reduced by diet and exercise. I see in the photo, here are some tips for lowering your cholesterol. So we have quitting smoking or having tobacco, minimizing saturated fats, exercising, avoiding stress, and keeping your blood sugar levels and watching what you eat.
In terms of diet, an unhealthy diet is going to be more likely to develop fatty plaques in one's arteries. High levels of fatty plaques in your blood vessels cause your heart to pump harder to move blood around the body. So that's what high blood pressure is. And so this high blood pressure, also high cholesterol and other chronic cardiovascular diseases, such as heart failure, increases the risk for heart attacks and strokes, which is why having a heart healthy diet is so important.
So now that we understand the importance of heart health and how your blood pressure and how cholesterol could very damage it and make your heart work harder to pump out that blood for your vital organs, this DASH diet is very vital in controlling your hypertension and controlling your blood pressure. So the DASH just means a dietary approach to stop hypertension. This is a diet to be found to be rich in minerals such as calcium, magnesium, potassium, and low in sodium, saturated fats, and meaty product. Therefore, trying to lower your sodium intake and lower your fats. So it's going to stop an increase on building that cholesterol and retaining that water that increases blood pressure. So, like in foods that the diet consists of fruits, veggies, whole grain, foods that are fat free, and etc. So something about the DASH diet is this DASH diet, of course, like I said, limits salt because an increase in salt increases water retention and therefore increases your blood pressure, making your heart work harder. It limits saturated fats, as I said, fatty meats and sugars, especially added sugars. So in this diet, it's very rich in minerals and fruits and vegetables. And in this diet, of course, you want to exercise at least 30 minutes, like walking around, trying to get your heart moving. Um, by following these guidelines, it will work to not only lower your blood pressure, lower your cholesterol, and therefore lowering your like I said, blood pressure. And something very important and vital to understand is that we should be eating less than 1 tablespoon of salt per day. And I know that's crazy, but that's very vital into understanding. Yes, we know that all our foods are very heavy on added salts, and not to add more salt to it, therefore increasing your blood pressure. And something that I found that was very helpful, if you could see this image, it like tells you, okay, this is the grains that we could eat and how much servings, vegetables and how many servings, dairies and how much servings, protein and how much that you could eat from it. We're not telling you to change your diet completely, but try to make minor adjustments in your diet and food changes so that it could help you. So like here are right here some type of food that you can make. Baba ganoush, you can make baked chicken and rice with onion. We're not trying to limit your food, we're just trying to expand it in a more healthier way.
Moving on to the Mediterranean diet. So while the DASH diet really focuses on keeping that salt intake in control, the Mediterranean diet focuses on incorporating plant-based food with limitations on dairy, poultry, red meat, and sweets. So when I say limitations, we kind of just want to reiterate that it's like dairy, eggs, poultry, such as red meat, in moderation, everything in moderation, firm believer of that. So this diet is going to consist of vegetables, fruits, whole grains, herbs, nuts and beans, extra virgin olive oil, and again, just everything in moderation. And then this diet, the following diet can lead to reduction in the cardiovascular risks, such as hypertension. Your heart will develop less platyfax, yielding the heart not needing to pump as harder to push the blood around. So by accomplishing consuming more vegetables rather than red meats, it's going to work to lower cholesterol and blood sugar. And then this diet also promotes 30 minutes of exercise 3 to 5 times a week. So just walking even can be that 30-minute exercise, anything to get up and going. And then I added some recipes as well. So we kind of see the Mediterranean diet pyramid on the left side. And then I kind of threw in some of my personal favorite breakfasts: sheet pan eggs and veggies. Hummus toast is my go-to. Breakfast egg muffins. And then for lunch and dinner, I threw in a cucumber and tomato salad, roasted tomatoes, Greek salad, Italian roasted veggies, roasted cauliflower, and loaded chickpea salad. So as you can see, this is really focusing on those plant-based whole foods in your diet.
Moving on to the flexitarian diet. This is a vegetarian foods with occasional meat consumption. So it's more to your preferences. If you're just trying to lower how much meat you're consuming, then you could add more vegetables. It's very forgiving and usually is the most helpful for if you're just trying to gradually make your way into a more vegetarian diet. And the focus is really to eat meat in moderation and not completely limit it. It's budget friendly since meat can be kind of expensive. It's flexible and focuses on using whole ingredients, keeping your helping to increase your fiber intake, keeping you full longer. And also decreasing your meat consumption can decrease LDL cholesterol levels, and LDL is just the bad cholesterol that helps create plaques. You might want to discuss with your primary care provider about starting supplements for vitamin B12, vitamin D, iron, zinc, or calcium if you're not consuming meat at all, or fortified milk, regular plant-based for the vitamin D and calcium. And with all these diets, if you're making drastic changes to what you're eating, you might want to consult your primary care physician or even a dietitian or nutritionist just to keep up with any places that you may be missing in your nutrition. And then here's just a summary of all the diets if you want to take a look at it. They do go for the pros and cons and just kind of at a glance what these diets would look like for you. And then for all of these diets, you want to kind of look towards MyPlate. That's kind of the US's guidelines for how you should be eating. Keeping in mind fruits, grains, vegetables, and protein. And that protein could be plant-based or meat. And then just once again, making sure that you are consuming whole foods and everything, and trying to kind of keep your diet balanced.
So if any of these diets look interesting to you, here are some links to recipes that are curated to each diet. So please feel free to scan the QR codes with your phone or type in the URL into your phone or computer as well.
So outside of diets, we just wanted to include a little bit of extra information for you guys because you're sitting at desks all day. We wanted to include some desk exercises. So that includes like shoulder rolls and shrugs, chair dips, air punches, walking and pacing, jumping jacks, and standing oblique crunches. You want to try and reach like a 10,000 step mark a day. So like the walking and the pacing is going to be really helpful. You want to try walking on your lunch break. Maybe if you can walk during like calls or when you have downtime. So you could scan this QR code to help you get a little bit more information on the exercises. And so we want to emphasize that the diet is like very important for improving heart health, but what's going to help it improve even more is also exercising. So this is the QR code for the post quiz. It's the same quiz as the one in the beginning. So we just want to have you go over that one more time, see what you've learned, answer the questions as best as you can. So we'll give you a second for that, and then we'll go over the answers. All right, so for the post quiz was the same as the pre-quiz. So we were just wanting to go over the answers just to see what you guys learned from the presentation. So the first question is, what is a DASH diet? A diet to reduce hypertension. Why is sodium and cholesterol bad for you? They make it harder for blood to circulate in the body. This is important because the blood carries oxygen. So if the blood's having a hard time circulating in the body, so is oxygen. What is the recommended daily intake of sodium? Less than 2,300 milligrams or 1 teaspoon of salt a day. And then what food group predominantly features in the Mediterranean diet? That's going to be plant-based foods. And then if you had the chance to scan the QR code to see the images, which is a heart healthy diet, the option A image is the correct answer.
Thank you, guys.
Thank you.
Thank
you.
you.
Thank you.